So I'm Gena Ghearing. I'm one of the new epilepsy providers at Mount Sinai. And today we're going to really be talking about things that you can do to help manage your epilepsy. Because your epilepsy team is very important, but we often only get to spend an hour and a half with people, every couple of months with you, and don't really deal with the day-to-day management of epilepsy the way that you do. And so what we really want to do is focus kind of on giving you some tools to help manage your epilepsy and maybe cover a few areas that we haven't really covered in other webinars before. So today we're going to be talking about medication, stress management, exercise and fitness, a little bit about social connectedness and stigma, and then navigating the workplace and school and hormones, and then give you some resources that we've collected. So I think Vincent's going to start out by talking about medication management.
Yes, thank you. I'm Vincent Palmieri. I'm a nurse practitioner here at Mount Sinai's Epilepsy Center. And medications is probably the most important thing to think about when it comes to epilepsy. I want to start with a simple analogy when it comes to staying on track with taking medications. You should think of your anti-seizure medications like a seatbelt. You're not expecting a crash every time you get into the car, but wearing your seatbelt keeps you safe just in case. Consistently taking your epilepsy medication is one of the most important ways to protect your seizure threshold and prevent breakthrough seizures. It helps to maintain a steady level of medication in your bloodstream, keeping your brain safe. To stay on track with your medication, we really recommend trying using a weekly pill organizer with morning and evening compartments and setting reminders on a medication app. You can also link your medication routine to a daily habit, such as brushing your teeth in the morning, so that it becomes a part of your everyday rhythm. These small strategies really can make a big difference in staying consistent, avoiding those missed doses or double doses, and staying in control of your epilepsy treatment. A great resource called the Nile app, which you'll see here on the right hand of the screen, it was recommended by the Epilepsy Foundation, and this was designed to help you stay on track with your treatment. It lets you record the doses that you take each day, as well as maybe tracking any side effects that you might be experiencing, and set personalized reminders. Whether you're taking that medication twice a day or adjusting to a new dose, it's a simple tool that supports that consistency and gives you peace of mind when managing your epilepsy. That way, the next time that you're with your provider, you can share this information straight from the app. And one other important tip to keep in mind is not to wait until you reach the last pill of the prescription. Sometimes medications need a prior authorization. So if you just give yourself that space of a few days, like 5 to 7 days earlier, to avoid any delays in getting your medication. Again, these small steps can really help with making it easier for you to stay safe, avoid hospital visits, feel more confident in control of your health. On this next slide that we have for you, please find that there's some amazing contact details regarding available support resources from different medications that are commonly prescribed to epilepsy patients. And this is going to be for your reference. But what you should know is that if a cost is a concern for you, please don't hesitate to speak up and to ask. Your provider can connect you with the prescription drug patient assistance programs, and they can explore different coupons and discount options that may reduce the cost of your medications. And again, we'll send this to you so you can have that for a reference.
That's great. Yeah, we encounter this problem all the time with trouble with getting meds. And so never worry about reaching out to your provider, because we've got a lot of tricks to help. Another thing that can really impact your seizure frequency is stress. I think we all know stress can make everything worse and definitely can make seizures worse. But having seizures also can be very stressful. So you can get into this cycle that goes back and forth. And we all know that stress causes real physical changes in our body, in our hormones, in our brains. And some of those are not too good for us. So we can't get rid of stress. It's part of our lives. Some stress is positive, having a new grandbaby, starting a new job. These might be great things, but we still need to cope with the stress. And so there's positive ways to cope with stress: going outside, getting some exercise, listening to music, talking to a friend, or talking to a healthcare provider. And there's negative ways to cope with stress. You can go down an internet, hole and kind of spend all your time there and spend all day in bed. You can start fighting with people, using drugs, alcohol. These things tend to cause more problems and really don't solve the problems. So this is one place if you want to go into the chat and kind of tell us about ways you've coped with stress, things that have been helpful. Give us some tips for things that you've done to manage stress, because I think we've all had this problem and have dealt with it in different ways. Recently, we've been doing a little bit of research too on ways to, some techniques that can be used to manage stress, basically mindfulness techniques and progressive muscle relaxation. And it's kind of cool that this research has shown that these things that all of us can do reduce seizure frequency, improve quality of life, improve memory, depression, and anxiety. So we're going to take a moment here and we're going to kind of give you a sense of what these techniques can be like. So we're going to do just the beginning of what a progressive muscle relaxation session would be like. Now, a full session would probably last at least 5 minutes. So we're just going to do the little introduction. And you don't need relaxing music, but we've got some, so we're going to start some relaxing music. I want you all to get comfortable. So you can sit down, lie down, whatever feels good. And I want you to take a deep breath and hold it. And now I want you to tense your toes, tense the arches of your feet. I want you to feel those feet lifting up, tight, tight, tight. Pay attention to the way you feel right now. Now relax, let that breath out, and relax those feet. I want them to be soft, loose. And I want you to think about how you feel as you relax. Now, if we were going to go on, we would move up to the calves and to the thighs and continue to move up the body. But I think you get a sense this is something everyone can do. You can do it at home. It doesn't take a lot of training. We've got some resources on how to do progressive muscle relaxation, some YouTube guides on how to do it, as well as some other mindfulness techniques and resources. So please feel free to use these resources. A lot of my patients get so good at it that they can kind of do it on the spot when they're pressed, someone's bombarding them and they can't think of the word, they're feeling overwhelmed. They can relax, reset their brain, and move on, So I think this kind of thing can be really helpful for dealing with the stress that we all feel every day. And it's actually been proven that, practicing progressive muscle relaxation every day, some people have less seizures with it. So it's pretty cool. Sometimes, though, it's helpful to have a team to help you with coping with stress as well. And so just like if you had a back problem, you might have an orthopedic surgeon who would be ordering tests, recommending different treatments, prescribing medications. You would also, though, likely have a physical therapist that was helping you with strengthening your muscles, keeping you from injuring your back again. So same kind of thing with mental health, that we often have a couple of different kinds of providers that can help with dealing with coping strategies. And so a therapist can be very helpful for kind of doing a lot of these mindfulness-based techniques and other cognitive behavioral therapy techniques to help with some of the symptoms that happen with epilepsy. So we've got a couple links to some different online resources for finding providers. And it's kind of cool too that you can actually filter by your insurance provider. So make sure this is someone that you're going to continue to be able to see. You can also filter to see if this is in person versus online, the types of therapy that you're interested in, if they have expertise in intellectual disability, PTSD, and then also trying to match up with things like sexuality, gender, faith, and languages. So quite a lot you can do with these online resources. And just moving on here. Oops, sorry, clicking the wrong spot. So another way that I think helps a lot with stress is exercise. And back in the day, people used to actually worry about people with epilepsy exercising. They were worried that it might bring on seizures or someone might get hurt. But as we've done more and more research on this, we found that exercise actually seems to reduce seizures for some people, maybe make them less severe, may deal with some of the cognitive injuries that can happen with seizures, make those less. And also, we know it helps depression, anxiety, your general physical fitness, and your quality of life. So trying to aim for that moderate exercise 2 to 3 times a week is just a great goal that you can try to set for yourself. And we've got some resources through the New York City Department of Parks. There's a lot of programs to help. Silver sneakers for those of us over 65. And then the Epilepsy Foundation has some great exercise resources as well. But of course, we want to be safe when we're exercising. And so there's some simple things we can do to make it safer. So I think even when you're not exercising, getting a medical ID necklace or bracelet is a good idea. And we've got a link to a program that can help with getting a wristband. They give you a little coupon that you can spend to get a nice little ID bracelet. Also, if you're hiking, running, biking, doing it with a buddy, always going to be safer. Sharing your location through one of the GPS locator services on your phone, also a nice little safety backup. And concussions are bad for everybody. So I am a big fan of helmets. And I really like that some of our professional athletes, like in basketball and stuff, are kind of normalizing wearing helmets now for all of us. So I think getting a couple of helmets, using them, that can really be another way to keep your brain safer. New York City does have some free bike helmet programs that can be useful. And you may think about the soft helmets too for some of the contact sports as well. I also do recommend that everybody puts their medical information on your phone lock screen. And we've got a little link that tells you how to do that too. So that if someone finds you, they can get your medical information without having to unlock your phone. And that way you can have your emergency contact information, lots more information than you'd be able to put on a bracelet or a necklace. So I think those things can all be helpful. We also do recommend if you're going to be near the water that you wear, a well-fitted life vest. Swimming, I usually recommend it's better to stay in a closed, protected area like a pool rather than the ocean, and that you make sure someone's there who knows you have seizures and could help you if something happened. So if there's a lifeguard, you can just say, I had a seizure earlier this year. So if it seems like I'm in trouble, I'm not messing around, help me. So asking for help can also be really helpful for making sure you're safe when you're exercising and out. One of the things that we know about epilepsy is that it can be scary to see a seizure. And often people don't understand, they don't know how to react. And so sometimes people with epilepsy can find that they lose opportunities to make choices, they lose independence, that they don't feel as accepted by their peers. They may withdraw, isolate. And then what we see is usually withdrawing and isolating doesn't make you more comfortable. It actually sometimes even increases the distress. So there's ways we really want to deal with this loneliness and help people to get out and be connected to the community, because we know that really helps reduce stigma. A lot of people with epilepsy are also dealing with the double stigma of having epilepsy and also having mental health problems too. So that makes it even harder. And the best way to destroy stigma is to talk to people with epilepsy and to hear what it's really like for people with epilepsy. And the epilepsy team here made a beautiful video last month on the Instagram where people with epilepsy are telling their stories and giving advice to people with epilepsy. And I recommend that very much if you haven't seen it. So I think talking to people with epilepsy is a great way to deal with loneliness. Also finding those people you do trust and talk to them about your diagnosis. If you can get a healthcare team that's willing to listen to you, that's also amazing. And joining a group with people that you have common connections to. You can do that online too if transportation's an issue. And those could be epilepsy groups, but it also could be a chance to volunteer or start a new hobby. If you want to learn how to knit or play chess or any of these things, it can be a way to connect with people. And again, don't be afraid to ask for help if you're feeling like you need connections in your life. One proven way to reduce stigma, to increase social connectedness, and improve depression, anxiety, and sometimes also improve seizure frequency are these epilepsy self-management support programs. So the Epilepsy Foundation has some good wellness resource toolkits there. There are also these programs that have, through the Managing Epilepsy Well Network, that have been shown to help epilepsy. And hopscotch is kind of focused more on the memory, thinking problems that can happen with epilepsy. PACES is more about emotionally adapting to the diagnosis. And Uplift is more with dealing with the depression and low mood that can happen with epilepsy, where SMART is more about reducing seizures and the complications related to seizures. So if you scan that QR code, you'll go to the Managing Epilepsy Well Network, and at the top there's a little link of the different programs, and you can select then, if you are interested in finding out more about those programs, you can connect on the participant link, and it'll go to the organizers of those programs, and they might have some spots available for these different programs. So it's kind of cool that these have also been shown to reduce seizures and reduce stigma and depression. We also have some great support groups through the Epilepsy Foundation, the Epilepsy Alliance, and Mount Sinai has a great caregiver online support group as well. The Epilepsy Foundation has a 24-hour helpline with a lot of good resources. And then, of course, it's good to have the connections for the crisis lines if you're feeling overwhelmed. And there's help for people with domestic violence and chemical dependency as well. At the bottom, we've got a couple of links as well to some of the volunteer opportunities if you're looking for ways to get out and get involved with different things. We've got a few resources for that as well. But of course, one of the biggest things for quality of life is getting an education, getting a good job, and being able to live the kind of life you want to live. So it's important to understand what we can do to help with getting through school as well. So even though 1 in 20 children have epilepsy, not all schools actually have a plan for what to do with seizures. And the Epilepsy Foundation does have some great tools for training school nurses and other other school personnel, as well as some handouts for teachers, safety plans, resources on seizure first aid. So that is really a great place to look if you're wanting more information about that. And I know school's going to be ending here soon, but before we know it, it'll be time to go back to school. And so you kind of want to also be preparing. So thinking about, making sure you're on schedule for bedtime, snacks, medications, to make that adjustment to going back to school a little easier. And you really want to talk to your teachers and school officials about what your kid needs. And make the time. I know it's hard sometimes to make times for the parent meetings and appointments. But there are certain rights for every kid. You're supposed to have a free, appropriate public education. And that includes kids with disabilities, and that includes things like special education and related services like speech therapy, physical therapy. So if you're interested in understanding what those rights are, that little link to the legal rights PDF does give you some sense of what kind of things you can think of when you're, designing an IEP or individualized epilepsy plan, or not epilepsy, education plan. So I think that's a nice little resource there. And unfortunately, we do still see bullying as well. So kind of recognizing when bullying is a problem and what you can do about it. Another little resource to help with that as well. We're going to talk a little bit about seizure action plans, because people don't always understand that not every doctor has made a seizure action plan. So sometimes they don't know how to make one. And then I think also the person who's seen the seizures, who has been there with you for the seizures, often has a better idea of what might need to be included in that plan. So the Epilepsy Foundation does have some really good little templates that you can use to kind of try to think about what you should have in a seizure action plan and, put those together for your school. And then kind of going to the two other sides of the spectrum for education. So for daycare, childcare, it's important to know that children with epilepsy need to be served by child care centers, and that does fall under the American with Disabilities Act. So it's another legal right that we all have. And then anybody at risk for developmental delay between birth and 3 years of age is eligible for early intervention services. So we've got a link to how to find early intervention services and how to get a child care voucher as well. And then on the other side, as you're kind of considering going to college, you really want to think about what you're going to need and how epilepsy is going to change your plans for college. So if you have to commute to college, are you going to have the same kind of support you would have on campus as you would have if you're living at home? If you're going to be living with a roommate, they're going to be somebody who parties all night. Is it someone you can talk to about seizures and seizure first aid? Those kinds of things you want to think about. You want to line up how you're going to get your health care and your prescriptions. And I recommend everybody talks to the disability services at their school and gets accommodations on board. A lot of my patients are like, I don't need any accommodations. But if you have a seizure during a test or something like that, if you've already got those accommodations in place, it really helps not having to argue the fact later. And don't forget about scholarships for people with epilepsy and disabilities. I've had quite a few patients get the scholarships. I think people don't always think about applying. You might as well take advantage of one of the things that is actually good. So having a good job where you feel like you're doing good work is also really important for quality of life. But we know that unfortunately, unemployment and underemployment is still way too common for people with epilepsy. But one thing that can help get a good job and improve employment is doing vocational rehab programs, and that has also been studied and shown to be a great benefit. These are programs where they offer a variety of resources. It can be, guidance about different kinds of work, job skill training. Sometimes they use rehab technology and tools. And they may help with writing a CV, hooking you up for interviews. So there are a variety of resources, and the Metro New York Epilepsy Foundation actually has a vocational rehab if you call to get connected. And there's also ones available through the New York State Education website there. A lot of our patients ask us if we should tell their employer that they have epilepsy. Yeah. And the answer is, it really depends on the situation. But in most cases, it is absolutely illegal for them to ask you any health-related questions until they have actually offered you a job. There may be some exceptions in specific situations, and that link to the Your Legal Rights kind of breaks that down a little bit more. But I do recommend that if you are going to talk about it, you really think about how you're going to frame your discussion of your epilepsy. Remember that a lot of people don't understand epilepsy. They don't know what it really is. So having them understand what impacts epilepsy really would have on your job or would not have on your job is pretty important. So a lot of people don't know that some people with epilepsy have never had a convulsion, only have seizures from sleep or are able to drive. So if those things are true, you might want to let them know that. So, you might want to kind of practice and think about what you actually want to disclose before you do. The other thing is that epilepsy does fall under the American with Disabilities Act. That means that you cannot be excluded from a job unless you are a direct threat to health and safety for yourself or someone else. And we can always try to reduce that risk with reasonable accommodations. So I think sometimes employers and sometimes providers, physicians can be a little too protective of patients and don't really take the time to stop and think about your job and how we can make it safe. Not all doctors know how to write for medical accommodations. So there's a little PDF at the bottom that kind of tells your provider how to think about medical accommodations and what the legal rights really are. And sometimes that can be helpful to give to your provider. But things that I commonly do for my patients is having a seizure action plan so that their coworkers know what to do if there is a seizure, asking for a steady shift instead of being on night shifts and morning shifts and having to change your sleep schedule a lot. And one thing that can really help you with protecting your job is asking for intermittent leave so that if you have a seizure, if you have a bad adjustment to a medication, or even just need to go for a medical appointment, you've got that protected time. And for eligible people, FMLA actually guarantees you that protected time. So talking to your doctor, even sometimes before you need it, about making sure that's in place. We also often ask for a locker where you can store your medications or a change of clothes, a safe place for you to go to recover after a seizure, and allowing you to return to work after a seizure instead of being sent to the emergency department or something that may not be necessary. We also can ask for accommodations if you're having memory difficulties, like checklists or specific training. We can ask for ways to reduce stress at work. So we can ask for you to be able to make phone calls to your doctor or have a service animal available. So these are all things that are reasonable accommodations to ask for in most jobs. Sometimes doctors are guilty of writing these very blanket statements in letters for return to work too, like no heights, no moving machinery. But the truth is we can often work and make these things safe. So thinking about the specific job-related risks you have and how we can reduce that risk. So I've had patients that are roofers and we use good safety harnesses and they're really not at risk. We can put down rubber matting for hard floors, pad edges. We can, change the monitors or the lights if there's flashing lights. We can use the shut-off valves for heavy machinery and safety guards. So there's a lot of accommodations we can ask for. And sometimes your doctor doesn't always understand what you really do at work. So sitting down and thinking about what the risks are and thinking about what can make it safer and bringing that to your doctor sometimes is a good strategy. And the job accommodation network down there at the bottom has specific accommodations for epilepsy and for other situations I often use it when somebody brings me something I haven't experienced before and I'm like, how can I make this safer? So that's really a good resource as well. There are a few jobs which it's very difficult to do with epilepsy, and that's mostly because they're very safety sensitive jobs and there's a lot of regulation. So commercial driving, either interstate trucking, bus driver, airplane pilot, military service, usually requires seizure control for years. And so it's not always feasible as a career option if you've had a seizure. And we've got some information on the regulations related to that. But typically for the military, you have to be seizure free for 5 years before joining. And for commercial driving airplane pilots, typically if you have epilepsy, it's very hard to get licensed in these. There may be exceptions if you've already been licensed and have a seizure, but even then, you're looking at needing to be seizure free for 8 to 10 years. So often it does require a career change. Unfortunately, I have had a lot of patients that are discriminated against in their job, even though it is illegal. And so if you feel like that's happened in your job, there's an epilepsy legal defense fund that can sometimes help out with a little advice. They also have a referral service. You can also make complaints to the U.S. Equal Employment Opportunity Commission or the New York State Division of Human Rights. This isn't always the right decision for everybody, going this way, but some people, the way we change things is by fighting and, asking for our rights. And not everybody's in the place where they can do that, but when you are, these are some resources that can help with that. We're going to kind of change now. We've been talking about navigating the external work and school and all those things. Now we're going to kind of think about how seizures can affect our bodies and our intimate relationships. So we know that seizures and seizure medications actually impact hormones. But we also know that hormones can change how likely you are to have a seizure or not. And these hormone changes also can impact things like health and weight that we might not think of as consequences of our epilepsy. So we're going to talk a little bit about that. The Epilepsy Foundation does have some good resources also addressing some of these on their website as well. So maybe what we understand the most about how hormones can impact seizures is something called a catamenial epilepsy, where many people who menstruate will notice that they have an increase in seizures at a certain stage in their period. And it's often a couple of days before or a couple of days after your period starts. But it might be different if you have cycles where you're missing your period, especially if you have irregular periods. And why this is important is because your doctor might be able to help you with managing this. But I also do want to mention that we still know so little about how hormones impact seizures. So I would argue we don't know much about how men's hormones impact seizures. We think men may be going through cycles like same kind of hormone changes every day that women are experiencing over 28 days. So we still have a lot to learn about that. And we have a lot to learn about how our trans people with epilepsy, how hormone changes are impacting them. So we have a lot more research to do on hormones and epilepsy. But if you are noticing that your menstrual cycle seems to be related to your seizures, if you do a little bit of your work on your own, it might really help with getting treatment. So I do recommend trying to chart when your seizures are happening and when your period is. And then if you can, you also want to try to document when you're ovulating. And there's a couple of ways to do that. There are now these ovulation kits that you can buy. They're a little expensive though. You can also measure your basal body temperature and chart that to figure out when you're ovulating. And the reason is because if there is a really clear cycle, sometimes we can add in an extra medication a couple of days before your seizures would increase, or increase your baseline seizure medications. And then we also have options with using birth control with hormones in it, or progesterone to try to treat the seizures as well. I'm not going to talk a lot about birth control because we have a separate webinar on women's health issues. But just to kind of briefly mention that hormonal contraceptives, so things like the implant, the pill, the patch, the ring, and the shot, all can impact seizure medications. And some seizure medications are actually not, I'm sorry, the seizure medications may impact your birth control, I should have said. So some seizure medications may make those hormonal birth controls not work quite as well. So you may be at risk for getting pregnant unplanned. The hormonal birth controls can also impact your lamotrigine level, your lamictal level. So occasionally people can have a seizure when they start on a birth control if they're on lamictal. So hormones can also impact your lamictal level. So if you're noticing side effects at certain times in your cycle when you're on lamictal, you get pregnant, you change your birth control, it's important you let your doctor know if you're on lamotrigine. So we probably need to recheck your levels. So I guess I'm just talking to your doctor about these things. We should be talking about this with everybody. It's, about family planning, knowing what your goals are on this and how we can help you with this. You should know things like if you're on oxcarbazepine and you need to use emergency contraception, say the condom breaks or something like that, how do you deal with that? What do you do? So these are conversations you should be having with your doctor. I've had a few patients also want to know about using PrEP for HIV prevention, and it's really recommended if this is right for you, that there's no reason with seizures that it's going to be perfectly safe to take it if you have epilepsy, and this seems like a good option for you to prevent HIV, because we really haven't seen much in the way of medication interactions or neurologic side effects. And obviously HIV and treating HIV is going to have a lot more consequences in terms of seizure medications and epilepsy. And something I think sometimes we don't talk about enough is how these hormonal dysfunctions can impact things like, so most women with epilepsy notice menstrual irregularities. There's an increased risk for polycystic ovarian disease, and many people have sexual dysfunction as part of their epilepsy, with a decreased desire for sex being the most common. But sometimes we also see erectile dysfunction and an inability to have an orgasm. And so these are pretty common. And again, something you should feel comfortable talking to your doctor about, because there's actually things we can do to help with these. And so again, this is a big part of life for everybody. And bringing this up with your doctor and being able to talk about it, I think is pretty important. Sometimes we also don't talk about menopause. So often when we're seeing those estrogen fluctuations before you go through menopause, when you're in the perimenopausal period, you'll notice a little bit of worsening of seizures. Some women notice once they go through menopause, they actually have less seizures. But I think it's also important that you know that people with epilepsy may be at risk for premature menopause and often go through menopause a little earlier than their mother did. So that's important to know when you're thinking about family planning and what you want from life. And something else that's absolutely fair to bring up with your doctor is the weight changes that we can see with epilepsy and seizure medications. So if you have a chronic illness, you are actually eligible to have meet with a dietitian once a year at least, and you may be eligible for other resources to help with weight loss that your doctor can help plug you into. We do have a few medications that actually can have weight loss associated with them. And we have a handful that are also cause weight gain, but we also have a lot of medications that are weight neutral. So if this is, if you're having this side effect with your medication, it's absolutely fair to bring this up with your doctor. And one other thing to discuss with your doctor is making sure you're having the monitoring that we recommend for good bone health in people with epilepsy. So we do recommend following your vitamin D level and also getting bone density screening tests to make sure that your bones are healthy. And the reason we recommend this is because people with epilepsy have 2 times the risk of fractures compared to people without epilepsy. And unfortunately, because it can happen with seizures or with a fall, they're often hip fractures and spinal cord compression fractures can really change your life for a period of time. So talking to your doctor, making sure you're getting the screening and any treatment if there's problems. But then also things you can do: stop smoking, everybody, please stop smoking. And avoiding overuse of alcohol. Also probably want to limit that caffeine to less than 3 cups a day because you don't want that bone turnover from increased caffeine. But then another thing is getting exercise again. It needs to be weight-bearing exercise. So that doesn't mean you have to lift weights. Great if you want to lift weights. But you can also dance, tai chi, yoga, walking, running. All of those things count as weight-bearing exercise. Circuit training, those kind of things count as well. Anything where you're bearing your own weight, putting pressure. Unfortunately, swimming and biking, great sports, but they don't quite count for the weight-bearing though. So those were the big topics we had on the hormones. We have some other resources to help manage epilepsy that we're going to share later. There's a bunch of different topics we're covering, things from like if you want to know about clinical trials for epilepsy, talking to kids about epilepsy, if you're looking for, is there any programs to help with watching your dog while you're in the epilepsy monitoring unit? The PAUSE program, PAUSE New York program can help with that. So we've got a lot of resources. If you guys have a resource that you found to be especially helpful, or maybe it's for something like, that maybe everybody wouldn't think of too, definitely put it in the chat, let us know about it. We've got some resources for specific populations, like cortical malformations, hypothalamic hamartomas, different things there, some seizure diary apps. And then the Epilepsy Foundation has created an online resource database for specific things as well. I also really like the Find Help portal. You can type in your zip code and type in the word epilepsy and see what comes up. Or if you need help finding housing, those kinds of things, it has some great resources there as well. So we've got quite a few resources we'll be sharing as well. But now we're getting to our most exciting part of the conversation, I think. Oh, I guess I forgot to mention too that we do also have a little handout on seizure dogs, which is a common question we're asked is how can I get a seizure dog? And how can I do it? So we've got a little handout on that as well. But this is what I was saying was our most exciting, and I guess it does link because I don't know if Rudy's available but the really exciting part of our talk, I think, is that we're going to spend some time talking to Diamond as well, who is really the expert here because she's actually living with epilepsy. And as we already mentioned, if you really want to understand epilepsy, you want to get over the stigma, you really need to talk to people with epilepsy. So, well, Diamond, do you want to go ahead and introduce yourself?
Hello, everyone. I am Diamond Matthews. I am 24 years old. Here's Ruby. She always has to be the showstopper, but I learned about my epilepsy towards the end of high school for me, my senior year, literally in January. It was during the weekend. I had 3 seizures, and my mom was just as shocked as I, and she immediately called 911, and we went to Mount Sinai. And from there on, Mount Sinai has been great for my help. I branched so much further. It used to be from going, to having my seizures very often to like maybe 2 or 3 times during the week. But now I only have seizures like maybe a few times in a month or a few times each month. Honestly, my last seizure before the past weekend was January, and it really shocked me. I kept asking Dr. Marcuse, like, are you serious? Are you sure? But yeah, ever since I've had epilepsy, it has changed my life. Initially, I wanted to go to an HBCU when I found out about it. I was very dying to go to Clark Atlanta. I'm telling my mom, I have to, I have to, I have to. And she's like, all right. And then I started having seizures, and my mom was like, I don't think I want you going that far from me. And I understood because I was too scared to go that far from my mother either. It was very new for me, but it's very new even to go into college. Like you guys said, with epilepsy, you're going into a field of a brand new bunch of people, a new roommate you're living with. But I survived. Surprisingly, I survived. And it has changed. Initially, I wanted to go into college majoring in accounting. I wanted to do a quick 5-year program that Clark Atlanta was practicing at the time, where you were able to get your master's degree in accounting at that in only 5 years. And I'm like, that's great. I can just see myself branching way further from there. But once I found out about it, I'm noticing like I'm going to have to rearrange the things I want in order to, grow as far as I want to in such little amount of time. That's always my train of thought. I don't know why, but once I found that out, I chose to go to school in Long Island, and I chose to do a bachelor's. I did business administration. It was pretty much the easiest thing for me to go in and out with, but then COVID hit, and when COVID hit, stress was like the best thing coming towards me. Seizures were very often for me during that time, and at that time, my neurology team was thinking way better. They were thinking like, we got to control this. And we talked about me getting an RNS. And ever since I had my RNS placed in my head, honestly, seizures have slowed down so much, and it continues to slow down. And I'm really thankful for that, because anxiety is something that I am very common to. It's just the simple fact that I never know what's going to happen when going outside. I don't know if I'm going to have a seizure in the train station, or simply once I walk out when I'm in my house, it's just very scary sometimes. But some of the best things I can say that I've been able to do to manage my seizures is my time with Ruby. Sometimes me and Ruby go outside, we walk, we run in the park. That's our favorite thing to do. Another thing that I love to do is paint. I always have my friends, my family come over and we'll paint during the weekends. It's like I feel like everybody is an artist. It's a way to zone out of reality and just focus on one thing. It's pretty cool. Definitely while listening to some music, eating, and just laughs. The the family and my friends, that's the best thing that I have gone for stress relief, because they help me to understand that it's okay. We got to take things one step at a time. So I can definitely say that. Those are things that I make sure to do to try to relax and like not stress as much. I also love to give myself personal dates, take yourself out, have a time of your life, nails, just simple girl things. But my simple advice that I would love to share with somebody that was in my position about 5, 6 years ago is to simply understand that this is not something that's going to take over your life. You just have to understand that this is just a phase, more importantly. This is a phase that you have to learn how to navigate through. You have to understand that to your family, and your family wants this to be, something that you're very, calm on. Everybody wants you to understand that this is something that's new, but they want you to do what's best. It's like everybody wants the best for you. Meanwhile, you're in the most stressful place. But at the end of the day, I just want you to maybe pay attention to those who stay by you through it all. Because once you have epilepsy, you're now trying a bunch of different medications, which can change with your weight. It can change with your moods. And sometimes some people go, some people stay. But I want you to understand that the people who are right by your side, like my mother and Ruby, those are the most important to help you to understand that this is just a phase and everything will be okay. So I think that's all that I kind of have to say. Epilepsy has really been a journey for me.
Yeah. I mean, that was beautiful to hear about the people who've stuck by you and how you dealt with coping, and giving the advice to everybody.
Thank you. Thank you. I really do appreciate this opportunity. And I hope that this is able to, help others to understand that this is just a phase. We keep going throughout phases, in life. And, it's okay. It's okay to try new things. It's okay to, and trying new things is very hard, I can say, because you never know what the outcome will be, but it's okay to get your toes wet sometimes. But yeah, I think that's all, guys.
Diamond, we have a question from the chat. Is it okay if I ask? They were wondering, how was your college experience? Did you live on campus in Long Island?
Yes, I went to SUNY or Westbury in Long Island. It was very different. I can say that because we went in and it was like college experience. It was great. My first roommate, she was very calm. And I was very calm because I was too scared in college. I didn't want to start having seizures and things. Like I tell you guys, it's very risky for me. But after that roommate, and then I kind of started to be by myself. I had my room by myself, even though it was like 2 beds. I started to have seizures again. So I had to decide who can really be there for me, who's not going to stand there and stare, who's going to get me on my side and try to de-escalate the situation. And after I did that, college, it helped me to gain my best friends now. That's honestly what I can say. But my college experience, education wise, it was amazing. I loved my classes, I didn't get to finish because of COVID hitting. And once COVID hit, more seizures started to happen for me. And I had to worry about more, I had to worry more on my health at that time. I'm sorry.
Great. Yeah. We have another question, and I think it's for kind of all of us, is how do you get help in college? Professors and attendance policies are not very understanding of how epilepsy works. I don't know if you experienced that, Diamond, at all.
I definitely had a lot of reasonable accommodations from my neurology team for certain things. When it came to like testing and having any type of seizures in classes, I really didn't have that. It happened when I least expected it, like when I was eating, maybe when I was walking from a class. But then I would need the time off for the next days following because my body, my face sometimes would be really black and blue. So the reasonable accommodations and doctor's notes were pretty helpful. And I already, that's the first thing I always share wherever I go when starting a job, when starting like a group. I want people to know I have epilepsy. So you're already known of it off rip so that it doesn't come like a surprise later on.
I think that's really important because I have run into the professors that are just not nice. And even though it's so clear that the person didn't finish their assignment because of a seizure or something terrible, they're not willing to make that, they won't change the policy. So
Yeah.
having those accommodations ahead of time, sounds like you had a great epilepsy team, so they did that for you. But having those in place before something happens, I think that's why I say I recommend always doing that.
It's very important.
Yeah. So I do think doing that ahead of time and taking advantage of the disability services, doing it that way instead of going specifically to the professor if they're not. Some professors, I don't mean to paint, obviously most professors are wonderful and are going to work with you, but every once in a while there is one who just doesn't. And so then using disability services, reminding them what the laws are, those things can be helpful, I think. I don't know. You've got.
Yeah, actually, Diamond, I was interested to ask about, were you able to get your medications, and how do you every day take your medications? What is your sort of organized way of doing that so you don't forget?
Yes, so I take my medication all at the end of the day by 7 p.m. I have
Okay.
a alarm on my phone. It goes off every day at 7 p.m. So if I don't have it with me, then I make sure I get home for 7:10 when it'll go off again. But that almost never happens. When I was in college, being that I went to school only in Long Island, I made sure to refill my medication once a month by coming home. So I did come home at least once a month each month because of medication and needing like doctor's appointments and things like that.
Okay, that's great.
We have another question that said, we mentioned tobacco and alcohol. How does cannabis impact seizure threshold or epilepsy management? That is a difficult question. So I should maybe just step back a little bit. So tobacco is important for bone health, but I wish I could tell you to stop smoking because it'll help your seizures, but probably won't. But alcohol probably is the most commonly used drug that we see that does impact people's seizure threshold. So just really using it responsibly, not overusing it. But I think cannabis is a complicated picture because, of course, we do have a prescription medication that we can use that is a cannabis product. It's the CBD that we can prescribe for epilepsy with, with the work, if you work with your doctor, there may be, that may be an option for treatment. But the problem is when you're using marijuana, even from dispensaries and things, it's a product that has many things in it. And some of those may help seizures and some of them might not. So you're getting a little bit of a mixed bag. There are concerns about using marijuana too, smoking, vaping can be bad for the lungs. We don't think it's good to use for developing brains, so for kids and if you're pregnant. And some people have bad reactions to the medication, and it's not as common as some drugs, but some people do become addicted to it too. So I think if you want to use marijuana, you definitely want to talk to your doctor, make sure they're aware. Again, don't worry about it. We hear this question so often, nobody's going to be upset about you asking about it. So just make sure you talk to your doctor if you're going to use cannabis, that you're doing it safely, as safely as you can. I don't know if there's more you want to add.
No, that's great. Yeah, I definitely agree with that.
Well, we had a new topic.
You mentioned
How
that
can
earlier.
exercise increase the seizure threshold? So there's been some research looking mostly at mice, that so that sometimes we use mice to better understand how people develop epilepsy and what we can use to treat it. And if you exercise these mice and then try to bring on a seizure in them, it is harder to bring on a seizure. If they've engaged in it has to be significant exercise, unfortunately. So with the health benefits that we tend to see and with the seizure reduction benefits, it usually does have to be significant so at least moderate, where you're getting your heart rate up and everything, for at least 15 minutes a couple of times a week, really does seem to be protective for health. I think also we all know that exercise can be a way of reducing stress and keeping, so often it's with epilepsy, when you have other physical problems as well, it just complicates things. So we know in general that people have better quality of life, better seizure control. The rest of your health is doing well too. So, staying on top of your other doctor's appointments and looking after those things can be very helpful. Reducing treating mental health, brain health, but also treating our physical health can really help manage epilepsy. Great questions. Yeah, I don't know.
Yeah, so when you're saying like moderate exercise, maybe something more intense, let's say if you were doing in a heat sauna, like some kind of intensive exercise with all that heat and the intensity of it, that might be something that lowers that seizure threshold.
Yeah.
But it seems like more moderate, healthy weight-bearing exercises is what's really ideal.
Yeah, so it doesn't, obviously it doesn't have to be in a gym either. You can be doing, kind of circuit exercise where you're doing like push-ups and then, just, keeping that heart rate up,
You get the benefits that way.
Yeah.
Yes.
And again, there are, training programs and things to help with that. Okay, we've got a new topic. I have seizures when I don't take my medications, but I still always forget. I'm really good at other things, but I can't get it together for my medications. Am I the only one? No.
No, not at all.
So we have research that shows, that this is fairly common. And so there, you already talked. Yeah.
Yeah, I mean, I think, of course, the most important thing is, we've got a busy day always ahead, right? Whatever you're doing with going to work, it's so important to have it organized and sort of a remembrance that you took the medication, right? So if you could just take at the 5 minutes that you have at the beginning of the week to really just make sure you line out all your medications for the week, that just sets you up for success for that entire week, no matter what you have to do. And then, yes, does that happen where you forget sometimes? It can. And you'd want to talk to your doctor, right, or your provider about what would be a strategy if you missed a medication, because they could guide you on when would be maybe the appropriate time if you remember to take the medication in the middle of the day. It just depends on the medication that you're taking. But there are strategies. Just communicate that. And sometimes I've had patients that want to buddy up with someone in their home or their family to be like the second person sort of checks out, and reminds you about the medications. But really looking for that support until you can develop that habit is the greatest thing. And as I mentioned earlier, brushing your teeth might be a habit that everyone hopefully does every day, right? And you can pair taking your medications with something that you do every day so that it becomes second nature. So you have less chances for forgetting that.
For me, that works,
right?
Pairing, taking medications with a routine, that's always worked well for me. But also talking to your doctor about ways, if sometimes they've got you on a complicated medication regimen, is there a way we can simplify that? Right. We know that if you only have to take a medication once a day, it's much more likely that we'll have more people doing that. Or if it's twice a day or 3 times a day, it gets harder and harder. So it isn't always an option, but there may be ways to simplify. And the prescription packs from the pharmacy is another way to simplify things, where you can have a pack, just take that at the specific time so you don't have to do all of that every day. Are Mount Sinai support groups available to everyone? Yes, they are available to everyone. And we'll be sending out some information that'll have the number to call if you're interested in joining. You don't have to be a patient. We have a great caregiver support group. And I should mention too, if you look at like the epilepsy, one thing, there weren't many good things about COVID, but one good thing is that a lot of our support groups got online. And so if you want to go to a lot of the epilepsy support groups now, even though they might be offered by a different state's epilepsy foundation, they're often much more open to having people from all over. So if you find an epilepsy foundation, so there are certain support groups for specific populations, and you find one of those that's really a good match for you, don't worry if it's based in Alabama or something like that. You know, that's the great thing, I think, about Zoom and these kinds of options. And same thing for the epilepsy self-management programs, is many of those are virtual as well. So you can do them from any part of the United States. Some of those you have to be in the US, I believe. Yeah. Just because of the funding, but yeah. But not for the Mount Sinai one. You can be outside of the United States. So if you're from Dominican Republic or Canada, please join. So I like to travel, but get so confused with medications and time zones. What should I do? So yeah, what do you do?
I mean, I would just make sure that you sort of plan ahead for the time zone change. And then just like Diamond had talked about setting up timers in her phone, that would be really great. But really making sure that when your phone changes, that it's the right time. But I don't know if there's anything else that you want to add. I mean,
sometimes it depends on how long you're going to be there. So if you're going to be in Japan for a month,
yes,
versus if you're going to Europe for, 5 days, so typically if it's going to be a short time, I say to just stay on your schedule that you would be here, because it's going to be too hard to switch over for a short time. So it might mean that you're taking your medication at like 2 p.m. or at a strange time, but you're staying on what your schedule would be in your home time.
So you don't have to adjust when you come back.
Yeah, so you're gonna just stay taking it the same time by your home time zone. But if you're going, you're going to be away for a long time, then I recommend gradually changing over to your new time schedule. So maybe every week you change by an hour, and so that you're going to be on time for your new time zone when you move. That's great. What I usually do.
That's great. Yeah. Let's move to the last slide.
Can we move to the last slide? But it has all the contact info. I'm sure we can. Here. Oops.
Oh, click, I think.
I need to click here.
Yeah.
Sorry, we're not very good at this, are we?
Okay. Oh, yeah.
Okay, so this is our contact information. If you have questions, you have recommendations on things we should do for webinars in the future, topics we should be covering, our social media accounts, and how to, connect with Mount Sinai to get more information. But we've got another question here. Do you have any advice for me? I'm very off balance on my meds, 79 years old, and can't even take a walk. Oh, that's terrible. But this is something your doctor really needs. You definitely, so our goal, our mantra, every epilepsy doctor should be no seizures, but also no side effects. We can't always get there for everybody, but that is our goal. And so I think sometimes as I feel like I have to teach my patients to complain, because epilepsy patients are so wanting everything to be good, that they tend to sometimes minimize how bad things are, and so you should definitely let your doctors know that you feel like your medications are making it difficult for you to walk, because there are ways we can help,
Right. It's important to share that information, especially if there's different medications that you might be taking maybe from another provider and something maybe changed for you. So definitely connect with the provider and please share that. That way they can take a look and see if there's another medication or a change in medication for you.
Okay. Do I have to tell people that I'm dating that I have seizures? And again, I think it depends on the situation, I think if this person is someone hopefully that you're dating and is going to be part of your life, you feel comfortable talking to them about this. As far as I know, we don't have much research on this. I know there was one paper on looking at marriage and epilepsy, and they actually found that you weren't more likely to get divorced if you didn't disclose you had epilepsy.
Oh, okay.
But I still couldn't imagine not wanting to share that part with someone that you were really considering a future with. So there's no one size fits all. It really is going to depend on what your relationship is.
Your comfort level of sharing that information and at what point in you're dating that you know, when you get to a certain level to be able to open up and discuss that. You know, and it's good because especially if you're living with someone, and you know, at some point, if it does, you want to make sure that someone knows about that. That way they can also be supportive for you. I think that there's definitely a plus to share that at some point in dating. So, but again, comfort level.
And I think you deserve someone
Correct.
that you feel is going to be there for you
Yes.
and be a support, be part of your team,
Right.
because you know you would be that for the other person. So
Absolutely. We have another question here. It says, how important is getting good sleep in epilepsy? I get so anxious about not getting sleep that it gives me insomnia.
I think all of us have nights where we don't sleep. So that is normal to,
Correct.
you know, to have some nights with bad sleep. So, but I think there are things, you know, so we didn't really share this, but there are a lot of good sleep hygiene, you know, if you just probably should include those in the resources, but a lot of good sleep hygiene techniques we can do to try to improve our sleep, you know, so the biggest things is the biggest problem for most of us is using screens and social media before we go to bed.
Right. I think another thing too that I've found talking with people is setting up some kind of routine for yourself. That way your body gets used to going to bed around the same time, as well as giving your you know, yourself time away from the screen. And in other ways, just like earlier when we listened to the music for relaxation, that might be added as well. You know, you might be dealing with some stressful things that could be causing that. So, you know, to help with the anxiety, I would recommend even doing listening to some meditation music as well.
I think meditation can be
Right?
great for
Yeah.
that. Yeah, and I think also trying to get rid of some of those bad habits. You know, I think all of us are guilty of, you know, you don't want your mind racing about Instagram or those kinds of things before you're going to bed. So I do think trying to get rid of that before bedtime is an important one. And, you know, so kind of letting your brain know when it's time to go to sleep. And then in the morning, letting it know when it's time to wake up. So in the morning is when you do want to get light and a hopefully natural light, you know. But obviously, if this is a big issue, you want to talk to your doctor because there's things that they might be able to help you with as well. And we have a question about, can sex trigger a seizure? And I'd say that's extremely rare. I think anything is possible, but I can't say I've ever seen it. Yeah. I've seen other neurologic emergencies, and seizures can happen anytime. And to be fair, any of us can have a seizure too, you know. So I'd say that is not something I would worry about. You know, I think it's okay. You know, that isn't something I would spend a lot of time worrying about. But obviously, if there's a pattern, you know, letting your doctor know as well, because it could be related to specific, you know, something other than just having sex, something else about what's going on at the time that tends to bring it on. And that, you know, sometimes we see like someone is having a seizure every time they're in the shower, and we can have to try to break that down. Is it the hot water? Is it the lights? Is it the time of day? Is it when they're taking their medications related to when they're taking their shower? So sometimes kind of breaking that down and understanding the different components for what might be causing you to have that kind of link. So this one is, I'm shy about talking about sex and things. Do people really talk to you guys about stuff like that? Yes. Although we should be the ones talking to you about it, because a lot of people are shy.
Yeah.
And to be fair, I was doing this for way too long before I realized that I needed to be doing. So I had a young man who was so sweet. And so I also think one of the problems we have is that we always talk about women's issues in epilepsy. We don't often talk about men's issues, or, you know, non-binary, everybody else's issues. Because believe it or not, women aren't the only ones with issues. And so I do tend to be a little more likely to bring it up with my women patients. And so he was in his 20s, and he brought his mom along with him, which he usually didn't do. And she had to explain to me that he was having sexual dysfunction because he couldn't bring it up. But I should never have made him do that. I should have asked him, you know, I should have been, as part of my normal screening, asking him, because we know about half of men with epilepsy have sexual dysfunction. So doctors should be bringing it up. It isn't common though, but we understand that for many people, this is a pretty important part of life. And to be honest, there's a lot of things we can do to help too.
So normalize talking about it and bringing it up to your provider for sure.
And if you're shy about it, there are, you can say I am. So saying you're shy, acknowledging it, you can write it down. There are other ways. Send a my chart message if you don't feel like you can bring it up in the office visit. Those are other ways to do it.
This last part.
Okay, so I guess we only have 4 more minutes. We've had some great questions. And our last question is, this is wonderful. Will this recording and slides be available afterwards? And they will be.
Yes, they will.
I'm
not sure how you will obtain them, but I'm
I
sure
don't
we
know
can
if we
send it
can.
out.
Yeah, so actually, are you guys able to tell us here? It's gonna be an email. We'll go
Yes.
out to everybody.
Perfect. So yeah,
Well-
you could just rewatch a lot of the video and make sure you have access to all these wonderful resources that are shared and will also be emailed to you. Yes, with all the links will be included in the.
We're gonna send a sheet with all the links from.
Fantastic.
But I want to thank you guys because you guys are the real experts. And we really would like to get your feedback too on what we could be doing differently, how we can make this better, and get your ideas about other things we could be doing as a community, help each other, because I think that's so important right now.
Yes. Thank you so
Yeah.
much.
And if you can fill out those feedback forms, we really appreciate it too. All right. Well, it was great meeting with y'all tonight.
It's been a pleasure. Thank you so much for joining with us.